Okay, everybody, well, we're going to get started. Happy Saturday. Welcome. This is our team launch. And what we want to do is help all of you launch an amazing business, a residual income with CTFO. We're to change the future outcome for thousands and then millions of people across the world. Now, this team is led up by Kelly and Lindsay Foote. And I just want to share a little bit. Kelly's been full-time in network marketing for 35 years. He's earned over $8 million, and he's either consulted or ran 400 different companies in this industry. So he is an icon and a legend, and we are thrilled to have somebody of that caliber that joined us full time back in September. And the next two are Rob McNulty and Steve Stuckey, both 25Ks. They both have been networking for over 20 years. They built massive teams. They're great networkers. And below that are so many leaders, I can't even begin to announce everybody, but we'll try to say hello to you at the end of this. So welcome, everybody. Today we have a special Zoom. We're going to be interviewing Dr. Trobiani. We've been friends for, we believe, about 25 years. Steve's a board certified neurologist. He runs his own practice here in Minneapolis, where I live, which specializes in pain management. In fact, he was hired by Pfizer when Pfizer brought Celebrex, and I know he'll tell the story because we're going to talk a little bit about that market and how it compares with 10X. He was hired by Pfizer to be the expert to train doctors on the COX-1 and the COX-2 pathway. He's a builder. He loves network marketing. He's a 10K. He's going to be heading to 100K probably this year. He's got a great team coming on. He's also a member of the scientific advisory board for the company. So he's one of the medical advisors. Doctor hosted his own radio show. I had the pleasure to join him 2 different times where we talked about CTFO and all the great stuff. He's a featured speaker for the company. If you get a chance to see him live, he is magic on the stage. I tell you, we were at his Christmas party and his Christmas dinner, and it was spectacular. He's an amazing chef, and he's got a wine collection that would put most fine dining restaurants to shame. And wow, if we start talking wine, we'll never get off the Zoom. So we're going to keep it focused today on CTFO. So Steve's an amazing person. He's a great friend. I'm thrilled he's here today. So Steve, you'll have to unmute yourself. Come on and say hello, and just maybe start out with a little bit of your medical background, your medical training, and what you've been doing for the last 30 years.
Okay, there. I've got myself off mute, and I can hopefully now be heard by everybody. Thank you for that introduction. That was very generous. I am happy to be here today talking to all of you, and thank you for taking the time to listen. What I want to do is do a deep dive into the science behind what CTFO has brought to market, so that we really have a good perception of why what we're doing is so different from what anyone else is doing and can do. We have an amazing product line, and before I get into that, I'll just simply follow up on Doug. So I am a neurologist. I did my training in neurology at Yale, finished my training at Yale, went on to join a person in private practice, did that for about a year, and then said, I don't really want to be in partnership with somebody else who wants to rule my life. I'm going to go do my own thing. So I ended up starting my own practice, and I've been running a practice in the Minneapolis area now for about 27 years. We'll get into the Pfizer thing a bit later, but what I want to do is talk about the endocannabinoid system to start with, so that people have an idea of how we differ. So if in the 90s, we identified the endocannabinoid system as an entirely different system of receptors in the body that has a function that covers a myriad of things. I'm going to stick with pain because that's the area I know. So within the endocannabinoid system, we have CB1 receptors and we have CB2 receptors. The CB1 receptors are present both in the brain and in the periphery. The CB2 receptors are primarily peripheral. You have some CB2 receptors in the brain, but nowhere near what you have in terms of CB1. The CB1 receptors are primarily activated by tetrahydrocannabinol, or THC, which comes from marijuana. The CB2 receptors are activated both by marijuana and by cannabidiol. Now, the marijuana plant, the THC in marijuana, comes primarily from that particular plant, whereas CBD is derived in this country and in most areas primarily from hemp. Hemp has very little THC and a lot of cannabidiol. Marijuana has a lot of THC and very little cannabidiol. So what we wanted was cannabidiol because it avoids the complications of THC. Because THC stimulates the CB1 receptors in the brain, it has a lot of uh, cognitive effect. So it will dull your thinking, it will make you tired, it will have a bunch of effects, including making people high, that you don't get from cannabidiol, because cannabidiol primarily and almost exclusively affects the CB2 receptors. And those are primarily in the periphery. So because it affects peripheral CB2 receptors, and those have an effect on modulating pain from the peripheral nerves and from muscle and other areas. You can modulate pain with all CBDs to some extent. The difference is that it's not going to really block the other traditional pathways for pain that go through the rest of our nervous system as effectively as CBDA does. And I'm going to go into that right now so that we understand that. So CBDA, which is the acidic form of CBD and the precursor for all CBDs, uh, cannabidiol A basically mimics anandamide. And now anandamide is a substance put out by our body whenever we become injured, whenever we have any pain, and it's a natural endorphin to block pain. But anandamide is then converted to arachidonic acid, and arachidonic acid is then converted to prostaglandins, and it gets converted to prostaglandins through two different pathways. Both pathways are mediated by cyclooxygenase. So when we talk about COX-2 and COX-1, the cyclooxygenase is the basis for that. Nobody wants to say cyclooxygenase over and over and over again because it's a mouthful. So we abbreviate that to COX, and that's where the COX or COX-1 and COX-2 come from. The COX-2 pathway only blocks prostaglandins that are involved in the formation of inflammation. So it is only involved in producing the prostaglandins that are involved in inflammation. So ideally, we want to block that COX-2 pathway and prevent the production of inflammatory response by those prostaglandins. The COX-1 pathway is involved in the production of prostaglandins that protect the lining of our stomach. It's involved in the production of prostacyclin, which is a prostaglandin produced in the arteries that dilates our arteries and prevents the formation of hypertension. Because if you don't produce enough prostacyclin, what happens is the arteries constrict, eventually they become stiff, and then eventually you have high blood pressure, which becomes permanent. It leads to the formation of plaque, which then hardens that artery more. It makes it harder for the heart to pump blood through the arterial system. So the effort is not to block those pathways, because we need those pathways functioning for optimum health. Unfortunately, all of the non-steroidal anti-inflammatories on the market block both COX-1 and COX-2. So if you're taking Advil, if you're taking Aleve, if you're taking Voltaren, if you're taking any of the anti-inflammatories that are on the market, you're going to, if you take a lot of them, you're going to develop high blood pressure, because you're going to block the production of prostacyclin, and you're also going to get some gastric irritation and eventually probably an ulcer as a consequence of blocking the prostacyclins that protect our stomach lining. So when Pfizer brought Celebrex to market, this was an exciting time because Merck had already brought Vioxx, which was the first selective COX-2 inhibitor to market, and Pfizer was now bringing another into the market to compete. But most of the physicians in the community didn't know the difference between COX-1 and COX-2 pathways, and didn't understand why Celebrex was going to be important. So my job was to go and talk to physicians and emphasize the need for selective inhibition. That did very well. Physicians understood the difference. They quickly embraced the need for COX-2 inhibition, and the market for Pfizer, Pfizer's product went through the roof. The insurance companies didn't like that because they had been used to all of the standard nonsteroidal anti-inflammatories on the market that were now generic, and both Vioxx and Celebrex were brand name only and cost a lot more. So they launched a war against COX-2, selective COX-2 inhibitors. Pfizer brought a third one to market called Bextra, and about the time Bextra came onto the market, it was becoming apparent that Vioxx in particular had about a 9% increase in hypertension in people who were taking it. And that occurred because, again, these were selective COX-2 inhibitors. They primarily affected the COX-2 pathway, but unfortunately, they also affected the COX-1 pathway to some extent. Vioxx seemed to do this more than Celebrex, and Bextra did it more than Celebrex. And so the FDA ended up taking Vioxx off the market and taking Celebrex off the market because both of them did have an effect on prostacyclin, which led to the development of hypertension. Celebrex survived, and the last time I checked, which was the numbers from 2014, Celebrex alone was doing $4 billion in sales in the US, and I think $6 billion in sales worldwide. So the market for a selective COX-2 inhibitor is large. This is important from the standpoint of what we're bringing to market because in 2008, the Journal of Metabolism and Distribution published an article that clearly established CBDA as a pure COX-2 inhibitor, not a selective COX-2 inhibitor, but a pure COX-2 inhibitor. So it affects the COX-2 pathway, and it affects the COX-2 pathway only. It doesn't have any effect on the COX-1 pathway. It is therefore entirely safe, and it is very effective in preventing those prostaglandins that lead to inflammation and pain. No one had one because CBDA was very unstable no one had one in 2008, I should say, because CBDA is very unstable. If it's exposed to any heat, if it's exposed to just time, it will degrade into CBD. It will lose the acidic moiety. That's important because what CTFO did, and the reason we're talking about this is their 10X product stabilizes CBDA, and they have now demonstrated that it will stabilize CBDA for at least 9 months because we've tested batches back from 9 months to look at the amount of CBDA, and there has been no degradation whatsoever. They've also tested this, heating it to 400 degrees Fahrenheit, and there is no degradation whatsoever at that temperature. So it's safe if it's exposed to heat. It is safe if it's exposed to, if it's bottled and it's kept for a period of time. We can probably go at least a year before we would lose any effect from CTFO's CBDA product, which is the 10X Pure Super 1000. Uh, that article I talked about also pointed out that if CBDA is methylated, if it's converted from CBDA to CBD, it loses its anti-inflammatory property. It loses its effect on blocking the COX-2 pathway. So none of the CBDs on the market, while they can, by activating CB2 receptors, modulate pain to some extent, none of them can block the production of prostaglandin and consequently block the production, the stimulation of pain at the periphery that's carried by the other pain receptors in the body. So the prostaglandins will activate all of the various pain receptors, including the CB pathways, uh, and convey pain through nerve endings in the periphery into nerves in our spinal cord that then go to the brain and tell us that we're having pain. If we can block those, we're going to get a more effective pain relief. And that's exactly why 10X Pure Gold Super 1000 is so much more effective than anything else that we have on the market, and why we have an opportunity here to actually rival the sales that Pfizer's had worldwide. There's no reason why this can't be a $6 billion product worldwide.
Wow, that's amazing. A couple of things, Steve, before we move on. First of all, it's obvious that the Dr. Trobiani is amazingly smart. And so if all of this didn't make a lot of sense, you're kind of brand new to CBD, don't worry about that. Just know that we have experts like Steve and others on this team that have that knowledge and can help at a very scientific level, at least for you to know that the science is there. And if you're brand new and just looking at this, 10X Pure is our delivery system. We're part ownership of that company. So we're part owners of the manufacturing, but we have worldwide distribution rights to 10X Pure. That's our product. CTFO is the only one that has that. That allows us to market our Super 1000, our CBDA pain creams, our multivitamin. 10X Pure just helps ingredients get into your body and into your system, become more bioavailable. And so it's used in a number of our products. We'll continue to expand that line. But when it's used with our CBD is where we have really, we believe, a 2 to 3 year advantage in the marketplace because just nobody else can rival it. So Steve, thank you, thank you. Let's move on and talk a little bit about glutathione and our Cell UV products. So we could spend an hour, guys, just on cannabinoids and full spectrum and our 10X. Today was just to give you a real good sense that the science is there for our CBD and our 10X Pure, but we also have another product that's equally as spectacular. So share with us what glutathione is, what it does, and why Cell UV is kind of the exclusive product that is affordable and is consumable. And just tell us that story if you could, Steve.
Absolutely. And this is another very, very, very exciting product. In fact, probably the most exciting product from my standpoint, because it addresses issues at a very basic elemental level. So glutathione is a complex amino acid. It's made up of glycine, cysteine, and glutamine. So 3 different amino acids are involved in glutathione. At the cellular level, it helps the mitochondria manufacture ATP. Now, ATP is adenosine triphosphate. It is the energy currency of every cell in every organ in our body. Without ATP, cells don't function. In fact, they die. I liken it to putting gas in your car. So you can have a Lamborghini sitting in the driveway, or you can have an old beat up 25-year-old Chevy. The fact is, if you don't put fuel in the tank, that Lamborghini is not going to operate any better than your 25-year-old beat up Chevy. It doesn't matter how good the vehicle is, it's going to have fuel to operate. Our bodies are the same way. If we don't have ATP, our organs don't function because our cells don't function. In fact, organs begin to deteriorate and we age very quickly and we head toward death. Disease processes set in and it's bad. So if we want to effectively prevent disease, if we want to slow down the aging process, we need to help the cells manufacture ATP so that they can keep performing at a peak, an optimum level. Glutathione does that. And we've known that for a very, very, very long time. We've had study after study after study in the medical literature. I think there are like 150,000 different studies on every disease process you can imagine, looking at the effects of glutathione. The reason we haven't been able to do anything with that is that glutathione cannot be absorbed through the GI tract, so you can't take it orally. All of the studies were done with glutathione injected either IM or IV, and the effect of glutathione will last for about 4 hours. So unless you can have somebody injecting you every 4 hours, there's no practical way to do this until now. What the inventor of CellUV did, and this is a guy in Canada who's been researching this for decades, what he did is he found a way to get cysteine, glycine, and glutamine through our GI system in a proper combination, so that one, they can be absorbed, and then once they get into the bloodstream and arrive at the cells, can be recombined to form glutathione at the cellular level and reconstitute that. That's important because we lose glutathione as we age. Our peak levels of glutathione occur at about age 20, which, not surprisingly, is right when we have peak athletic performance. And then they deteriorate from that point forward. And we lose it exponentially as we age. So by age 40, you've lost 40% of glutathione. By my age at 70, you've lost 70% of glutathione. And that decline mirrors the decline that we see with age. So I'm excited about this because getting this back into the system has extraordinary consequences, not only on disease processes, but on the longevity that we can expect with time, and maintaining our cognitive focus, maintaining our athletic ability, maintaining our cardiovascular tone, et cetera, et cetera, et cetera. It's important that it be taken in quantities that are effective. So if you're young, the package says 1 scoop a day, and that's probably fine if you're young. But if you're over 40, you probably need more than that. And if you're over 60, you definitely probably need to be at 3 scoops a day. I do 3 scoops a day every day. My wife does 3 scoops a day every day. That makes a difference. If I drop it down to 1, I'm more tired. I'm mentally more sluggish. If I go back up to 3, my mind is sharp. I'm quick. I can keep everything I want to keep in my head focused, and I can be more effective in my day-to-day active practice. So I like it this way. Athletically, it's made a difference. I don't know if we have time. Doug, do you want me to talk about the tier ahead?
Well, let's keep going, Steve. If we have time at the end, we'll come back to that. But we got some other stuff to get onto. So, no question.
Okay.
Our CellUV is it changed lives. Every week we hear stories of people just seeing pretty almost miraculous things happen, because once you boost your glutathione levels, it's helping your body produce fuel at the cellular level, which is going to affect your whole body. Is there another competitor? Have you seen, is there another product that's close to competing with this, either effectiveness or price wise?
There are 2 other competitors. There are 2 other products on the market that have an oral glutathione. The closest competitor is 3 times more expensive than CTFO's glutathione. And I don't know, quite honestly, whether it's as easily absorbed as ours is. So price-wise, there's nothing that comes close. But certainly there are others that could compete.
Yeah, outstanding. Thank you, thank you. And really, how the market's really endless, isn't it? Wouldn't you say anybody maybe 30 years old and above would be a good candidate for a cell UV?
I would say actually 25 and above,
Yeah,
because you've begun losing your glutathione levels at age 20. They begin declining at age 20. And if you talk to 25-year-olds, they will tell you that at 25, they're not competing athletically as well as they did at 20. So they're already beginning to see it if they're active. Because my kids, played soccer through high school. They played soccer through college, and then they joined adult leagues after they got out. Well, they were not able to function in the adult league the way they were able to function when they were in college. And that's we're not talking 30 or 35 at that point. We're talking 25 when they're out of college. So it's noticeable, and it's noticeable early on in life.
yeah, yeah. Thank you, thank you. So, Steve, your practice is primarily made up of people with chronic pain. You're
Yes.
you're an expert of helping people that are really suffering and they need to go to an expert for help. And that's what you've been able to do. And you've told me some stories about your experiences with your patients and right in your practice for real world firsthand. Just share a little bit of what you've seen happen with the 10x Pure and the cell UV and what that's done for your population base.
Well, the most interesting thing is I asked CTFO to formulate a product for me that was a bit stronger than anything we currently have on the market. Now, I'll tell you that's going to be coming in the near future, but it's not there yet. Uh, that particular product I was able to use on people who've been on long-term narcotics for uh, over a year. That was a requirement. They had to be using a narcotic for more than 1 year. And I had a group of patients who were on lower doses and some on very high doses because I wanted a range. Um, we were able to reduce the narcotic consumption in those people, and we're able to reduce that pretty effectively. Uh, More importantly, it reduced their anxiety. And that was an unanticipated consequence of what we were doing. What I found, almost all of the patients that I had been treating were on benzodiazepines because if you have chronic pain, you're also dealing with the effect of chronic pain on your life, which brings about a certain degree of anxiety. And all of them were somewhat dependent on benzodiazepines to reduce that anxiety. The problem we have is the CDC has pointed out very clearly that your risk of fatal accidental overdose from narcotic triples if you combine a benzodiazepine with a narcotic.
Mm.
And so they have been adamant about taking people off of benzodiazepines if we can. They're not mandating it because they realize that there are people who can't come off them. They need them to function, but they're recommending it. What I found is everyone who had taken the CBDA we were using came off their benzodiazepines.
Wow.
Uh, if they didn't completely come off it, they were able to reduce it by 75%. So their doses were much lower. That was very, very, very interesting. Now, what we were using was a combination of CBDA and CBGA, and it's very likely the CBGA was responsible for that decrease in anxiety. We have therefore brought the CBGA to market, and that's a product we call Bliss.
Yeah.
Again, no one else has this because CBGA, like CBDA, depends on that acid component of CBG being maintained, and you can't maintain it without 10x. So the CB Bliss has a stabilized CBGA because we're using 10x to stabilize the CBGA, and it is a very effective anxiolytic. So we already have that on the market. We will be bringing a professional strength pain reliever to market sometime in the near future. But I should point out the anxiolytic part of this that I noticed is already available now. And that's exciting.
No, it sure is. And is there ever a chance that any of this might ever make it into a published journal?
Yeah, actually, a pretty good chance of that. I submitted this to a peer-reviewed journal. I won't say where because we're not allowed to yet, but they got back to me almost immediately saying they were very interested. It's going through their peer review process now as we speak, but I fully expect we're going to have a published article on this. And that's important because if you look at a lot of supplements on the market, they talk about uh, clinical trials and they talk about double-blind, placebo-controlled clinical trials, but they never talk about published clinical trials or published double-blind, placebo-controlled clinical trials. Anyone can do a clinical trial.
Yeah.
Getting it published is a whole different level because I can do a really lousy clinical trial that I know will tell me what I want it to tell me. All I have to do is go to CTFO, have some of the people who work at CTFO try the product, tell me how much they love it. And now I can come back and say, you know, I improved everybody's performance 3,000%. And I did this and I did that. And, you know, if I submit it to a journal, they're going to say, no, we're not buying any of that garbage and we're not going to publish it. So it has to be a well-constructed trial. It has to be, the data has to be legitimate, and it has to stand up to scrutiny to get published, especially in someone who's going to stake their reputation on the data that's being presented. So publication is important. I do think we're going to get this published again. They've seen the data, they like the data, and they're excited about the article.
Wow. So stay tuned, everybody. There's more things that are in the works that as good as everything we have right now, there's more big things coming. Wow. So I'm going to combine the next two together because I want to save a little time for any questions, Steve. So I know you work closely with the owners as well as myself and Kelly Foote on a weekly basis. And so just share your opinion of the ownership of this company and also kind of where you see the next 5 and 10 years for CTFO and what our growth is going to look like.
Yeah, the owners of this company are amazing people. They are spiritually driven. And when I say that, I mean that in every sense. Their mission is to help people improve their lives. And they are uh, excited about having products that are impactful. They're excited about knowing that they can go to bed at night, knowing that their products restored people's health, improved people's health, or maintained people's health. And that's their primary focus right now. In fact, Stuart Finger made that statement and clearly said he was involved in, both Steve and Stuart were both involved in multi-level marketing companies where they made a great deal of money. And in those companies, it was all about the money. It was all about what they were able to make. Here, they said they are more excited about what their products can do to improve people's lives, restore people's health, or maintain people's health. And their comment was, if we can do that, the money will follow. We're not worried about the money. The money will always follow if you can do that, because that's an amazing, amazing goal. And they're absolutely right. That's always been the case. I've behaved that way throughout my practice. And I've always known that if I do what is good for my patients, I'll prosper. If I do what is more in my interest and not in my patient's interest, it's going to come back to bite me. And that's true of every doctor I know. I've seen people flourish and I've seen people die in their practices. The ones who are self-interested do not do well. Those who are interested in helping their patients and put their self-interest aside, do very, very well. And they do well financially as well as professionally. And that's even more true in network marketing. And the owners know that. They know that they can help people by helping them financially as well as medically, because quite frankly, if you don't have enough money to live on, you can't take care of your health. So you need both. And we have the ability with the products that we're bringing to market to do that. People can make a very, very good living in this company. And I think we're going to go from what is now a multi-million-dollar company to a multi-billion-dollar company just with the products we currently have. And I can't imagine that we have an interest in not bringing new and more impactful products into that pipeline as time goes by. So it's going to be an exciting ride over the next 5 to 10 years. By the time 10 years are up, I'll probably want to retire because I'm going to be getting into my 90s at that point. And I'll turn things over to my sons who can enjoy that ride through their lives.
Oh. Well, thank you, Steve. You are more than fascinating to listen to. And I've been hanging with Steve for 25 years, and I still just the science, the knowledge, and to know what's behind the curtain in our products is really exciting. So everybody, I'm going to save us some time. We'll just open it up. If you got a question for Steve, you'll have to unmute yourself. He is pretty well diverse in just about any question you might have. Don't ask him about his favorite wine because we don't have time for that right now. But I can tell you, he's got some phenomenal wine. Oh my gosh! But we'll save that. So I'll just open up for any Q&A, or if anybody's got a comment today, fire away.
I have a question.
Go ahead.
Yeah.
Steve, what is your opinion of hemp oil compared to CBDA?
Again, hemp oil is not going to give you the acidic form of CBD because it won't remain there. The only thing you'll get from hemp oil is a variety of the CBD categories. So CBD, you have CBD, you have CB, I think there's a CB, maybe a little CBG, although CBG is a precursor to all of them. You're not going to get much CBGA in it. You might get some CBG, and you're going to get CBD and CBV, but you're not going to get the acidic form. And it's the acidic form of CBDA, as I said, that has the anti-inflammatory property that I'm excited about, because it's the only one that's going to block the production of prostaglandins and stop the production of pain at the periphery, because it's the prostaglandins that initiate the pain impulses.
Thank you.
All right, who's next?
I have a question. This is Bonnie. I use CellUV, and what it does for me, it spikes my insulin. Is there a way or another product maybe they can put together for people that have that problem? Thank you.
It does what?
It spikes insulin.
It spikes insulin. Interesting. I'm not sure why it would do that, honestly. So you're seeing your blood sugars drop?
No, it went up.
So it impairs your insulin. Your
Right.
blood sugars went up, because if it were spiking insulin, your blood sugars would go down. So it's blocking your insulin. Now I'm not sure why it would impair your insulin or would create any insulin resistance. The only thing you're looking at in CellUV is whey protein. The protein, if anything, is going to be neutral in that regard.
Hey, and,
I don't know why it's doing it. I suspect there may be something else going on.
Bonnie, send me an email with just kind of anything else you're using for any medications and current health, and then I can send it to Steve where he can do a little deeper diagnosis.
Yeah, there's got to be another reason. It
Let
shouldn't
me
do that.
tell you another thing. From my perspective, it may be what you're taking the CellUV with.
Right.
Because if I take
Yeah.
it by itself or just in something with no carbs, I have no problem. If I put it like in a shake with other fruits and things, yeah, my insulin does go up.
Well, your sugars will go up. Your insulin won't go up. Your sugars will go up.
I Googled it and they said whey protein is a carb.
No, whey protein is not a carb. It's a protein. There's if you look at the label on CellUV, there's very little carbohydrate in there. It's almost all protein. It's 9 grams of protein per serving, and really nothing by way of carbohydrate. No, it's what you're putting it into that would do it. I personally like to put it into lemon iced tea, and the lemon iced tea has a lot of sugar. So I'm going to get some carbohydrate that way. And what you're mixing it in may be the reason
Water?
your sugars are rising. You shouldn't know. Water won't do it. Water's not doing it. I don't know why your blood sugars would rise when you're doing that. It doesn't make sense.
So Bonnie, just shoot me an email with kind of what's going on, and we'll do a little more diagnosis for you. Okay, anybody else got a comment or question today?
Doug, I've got a quick question.
Yeah, go ahead.
If I gift or somebody's going to purchase CellUV like a loading dose, so they order the 3, what's the expectation that I should present with them after, say, 10 days or 30 days? What are some of the common, enhancements in their health or emotion, things like that I can kind of present without over exaggerating?
I can tell you without exaggerating at all. In 10 days time, they will see an increase in athletic performance. If they're working out, the recovery time will decrease. In my particular case, my speed increased in running at 10 days time. They'll see an increase in mental clarity and mental focus. They'll see an improvement in their memory, and they're going to see an increase in energy levels overall. They're not going to be as tired. They will be sleeping better during that time as well. And you're going to see this in 10 days without hyping this at all. Beyond that, you'll see further improvements. If you are dealing with any inflammatory process, it's probably going to also, because CellUV will improve your immune function, it's going to diminish that inflammatory process in that time. My wife, who was dealing with eczema, found that the itching she had with the eczema was gone within 10 days. It took about 30 days before the rash went away, but the pruritus, the itching that was there, was completely gone within 10.
Very cool. Very cool.
I have a question. What products would you recommend for people with like bipolar?
Okay, I would, just because CellUV helps everything, I would take CellUV. Beyond that, we don't, the Bliss CBGA is going to decrease some anxiety if there's some anxiety with their bipolar illness, but it's not going to stop depression. And if they're in that phase of bipolar, and it's not going to keep them from getting manic. So if they have bipolar illness, they need to be on the drugs that we use for bipolar illness to stabilize their mood and stop those swings, because those swings are awful in bipolar. And this is by no means any we don't have anything that's going to replace the drugs we use. What we want to do is improve their body's ability to function, and certainly CellUV is going to do that. Bliss is going to maybe help with some feelings of anxiety if they're dealing with that. But those are the only two that are going to really have any meaning in that. But it's not going to replace their drugs, and don't even suggest that it would.
Well, how about the sleep or sleep type of CBD? Would that help with them also, just to get a good night's sleep?
Yeah, well, getting a good night's sleep is going to help. And as I said, one of the effects of CellUV is it does that. It helps you get into a deeper sleep and sleep better. The sleep spray, if they're in their manic phase and they're having a hard time getting to sleep, the sleep spray will help. So that's going to be useful. But hopefully, if they're taking their drugs properly, they're not in a manic phase. What the drugs do is keep them from going into the manic phase and going into the depressive phase, and keeps them on a more even keel. And it's important that they take their medication, because, as I said, nothing we have is going to be as effective as what the pharmaceutical companies have for bipolar.
Okay, thank you.
All right, everybody. Well, we're going to have to wrap up. I'm going to be getting ready for my next Zoom coming up. Doctor, thank you for joining us today. It is a pleasure to have you as part of our company and on our scientific board, and knowing we've got experts like you helping to lead the way and really be able to bring the science and the evidence to help people know what they got a hold of, because we really do have a special company, everybody. So with that, I will get this recorded on a YouTube link, everybody. I will get that out via our Facebook group as well as email. So if you want to get this to somebody that couldn't make it, I'll have that out hopefully today or first thing in the morning. And then our next event will be Wednesday night. So Wednesday at 7 p.m. Central Time, we'll come back here for a short 10-minute YCTFO and some training to show people how to make money and how to get their business going and get that residual income up. So thanks again, everyone. Thank you, Steve.
You're welcome. Thank you.
Thanks, everyone.